Hi everyone, I welcome you all to this course on autism spectrum disorders. If your child has been recently diagnosed with autism, or you're just someone wanting to learn more about autism spectrum disorders, then you have come to the right place. So let me introduce myself. I'm Rashmita R and I am working as a speech language therapist at 1SpecialPlace. I have completed my master's in speech language pathology. I've been working with children, adults, and geriatric population in the areas of speech, language, communication, and swallowing since the year 2018. So here are the topics that we'll be covering in this course. So let's begin. What is autism spectrum disorder? It can be explained as a neurodevelopmental condition that possesses numerous challenges in multiple areas of life, such as communication, social interaction, behaviors, etc. And autism is a spectrum disorder. What this means is that every individual diagnosed with autism will have their own unique strengths and challenges. And what we need to understand is that autism is not a disease that can be cured completely. Rather, it's a lifelong condition. And what we can do is to help cater to each of these individuals' needs, and we can definitely help them to reduce the impacts of all these challenges by providing appropriate care. So it's found that approximately 10% of those diagnosed with autism possess something called as exceptional skills or savant skills. So they may outperform their peers in specific areas. It could be mathematics, art, musical skills, etc. So the statistics suggest that ASD is more often seen in boys than in girls. And because of their challenges and their strengths, autistic children show different ways of learning when we compare them to their neurotypical counterparts. So neurotypical kids means children who follow a normal pattern of development. So this diverse, learning type may include some children can be visual learners, some are auditory learners, some may be both visual and auditory learners. Now moving on to the causes of autism. Though the exact cause of autism can never be pinpointed, here are some of the possible causes. And this may include parental age. So it's found that children who are born to parents at an old age, that is approximately about 35 years of age, may have a higher chance of developing autism. Another factor is the environmental factors, that is exposure to environmental toxins or heavy metals during the stage of pregnancy may pose a risk for developing autism. Other cause can be genetic differences. It's found that mutations such as the Fragile X syndrome is associated with autism. And some other causes may include differences in the brain development or in brain function of the children, and improper balances of neurotransmitters in the child's brain can also lead to autism. So the next topic is, when can we identify autism? The age at which the autism signs are visible may vary from one child to another child. So often what we can see is that it's the behavioral signs that are evident, and in some children these signs are visible as early as 6 months to 18 months. And some of these behavioral changes or signs may include absence of eye contact. You may notice that the child is not giving an eye contact when you're talking to the child or when you're interacting with the child. And another behavioral change is not giving any response to when you're calling the child's name. Another one is that you may notice that the child is not able to understand others' feelings, like when you are sad or when you're getting angry or happy, the child is not able to relate to your feelings. Another one is that you may notice that the child may be showing some repetitive behaviors such as flapping with their hands or staring at an empty space for a long time. So the major red flags or the signs and symptoms come under three main domains. So the first one is the social communication and interaction. The next one would be the repetitive behaviors and interest, and then the issues with communication and language development. So moving on to the first one, what are the red flags that we need to observe under the domain of social communication and interaction? So this may include not giving an eye contact during an interaction and not responding to name call, which should happen by 9 months of age. And you may notice that the child does not show any facial expressions like happiness, sadness, anger, or the feeling of surprise. The child does not show all these at least by 9 months of age, and does not engage in simple interactive games such as peekaboo or patty cake at least by 12 months of age. And you may notice that the child may use very few gestures such as waving goodbye, which should ideally happen by 12 months of age. And you may see that the child does not draw your attention towards things, or they may not show you the things that they are interested in. They do not use pointing using their index fingers to show you something that they are interested in, or they don't notice when others are hurt or upset, or they don't pay attention to other children and join them in play. So what are some of the red flags that you may notice under repetitive behaviors and restricted interest domain? So this may include, they may have a tendency to line up toys and other objects in a specific way, and they may get upset when the order is changed. They may develop rituals such as lining objects up or repeating the same things over and over again. They may be obsessed on parts of objects such as the wheels of toy vehicles. They may get upset by minor changes. They may have obsessive interest, for example, dinosaurs. They would love to play with dinosaurs all the time. They will be knowing all the names of dinosaurs. They would want to know more about it. It's like an obsessive interest towards it. And they must follow certain routines in a way that, if any of the routine is changed, then they will get upset. They may flap their hands, rock their bodies, and stare at the ceiling or at the fan for a long time. Sometimes they may show an over response to sound, such as by closing their ears. Sometimes you may notice that they don't give any response to sound at all. Same goes with textures as well as other sensory inputs. Here is a video that shows the behavioral differences between a child who has autism spectrum disorders and a child who follows the normal developmental pattern. So please pay close attention towards these behavioral differences. Moving on to the next topic, evaluation of autism. So most often, autism evaluation does not end in a single consultation. It is a process that involves several steps. So usually when parents start noticing a change in child's behavior or a delay in their milestones, they would consult the doctor, and the doctor would do necessary physical and medical examination and would make further referrals to other professionals. And also, if the child goes to a school, then the teacher may observe certain symptoms in the child and make further referrals to other professionals. So the evaluation begins with a detailed case history consisting of information regarding the child's birth history, medical history, family history, details of previous investigation and rehabilitation, and of course details regarding the speech, language, motor milestones. Now moving on to the professionals, the team of professionals. So as mentioned earlier, autism involves several challenges. Hence, it has to be diagnosed by a team of professionals. So the team may involve a developmental pediatrician. So autistic children may face numerous developmental issues while growing up. So a developmental pediatrician diagnoses and develops treatment plan for these children. They also work with adolescents and their families and help them cope with numerous developmental, behavioral and learning problems. Next is a neurologist. So many autistic individuals may have seizures or epilepsy. So symptoms of a seizure may include unusual staring, stiff muscles, uncontrolled movements of the arms and legs, and confusion. So a neurologist can help diagnose and treat such neurological conditions. Next is an occupational therapist. So autistic children they may face difficulty interacting with the environment. They may be under-responsive or over-responsive to the environmental stimuli such as sound or touch or visual stimuli, movement, etc. So a sensory integration therapist can help the child to integrate such sensory inputs. Further, autistic children may also show difficulties in performing simple everyday tasks such as brushing, bathing, dressing, etc. So an occupational therapist helps the child to perform this task independently. Next is a speech language therapist. So one among the common challenge faced by a child with autism is the delay in their speech development or a loss of previously acquired speech or language skills. So a speech language therapist helps to diagnose and treat the various speech, language, communication and also feeding difficulties faced by the autistic children. Next is a special educator. So autistic children often face difficulty with learning, and a special educator focuses on developing the academic and pre-academic skills a child will need to benefit from school. Next is a psychologist. A psychologist works closely to evaluate and treat the various social, emotional, behavioral issues faced by individuals with autism and in providing effective counseling to their caretakers. Next in team is a nutritionist. So many people with autism are sensitive about the food that they eat, and most often they show preferences to certain food or aversions towards food. So some experts believe that certain dietary changes can help manage autism. So these changes may involve avoiding specific food as well as taking dietary supplements. For example, many children with autism show gluten and casein intolerance and are on gluten-free or casein-free diets. And a certified nutritionist can help to make sure the child is meeting all the nutritional requirements he or she needs to grow into a healthy adult even while on the special diet. So autism evaluation usually begins with the screening tool. So it can be a questionnaire that checks if the child shows the features of autism, and it is less time consuming when compared to a detailed test. So if the child fails the questionnaire, then it requires the need for a further detailed evaluation. So the detailed evaluation consists of a set of tests in which the clinician directly observes how the child plays and interacts with others. So it also helps to identify the most challenging areas that can be later focused during the therapy. Some of the commonly used screening questionnaires that we see are the Modified Checklist for Autism in Toddlers, that is the MCHAT, the Childhood Autism Rating Scale, CARS, the Indian Scale for Assessment of Autism, ISA, the DSM-5 Checklist for Autism Spectrum Disorder. Moving on to the detailed evaluation for autism. Though the screening checklist points out several features of autism, we cannot confirm the diagnosis until and unless we do a detailed evaluation wherein we observe the child performing the specific task. A gold standard assessment tool that is commonly used for autism assessment is the Autism Diagnostic Observation Scale, ADOS. So it evaluates the social imagination, and the social imagination and communication skills of individuals who may have autism spectrum disorders based on the observation of their direct interactions. It uses planned social situations to trigger the target responses and interpersonal interactions. A wide range of verbal, physical, social, and imaginative interchanges are elicited through planned communication opportunities. The test is elaborate and takes approximately 2 hours to complete.
I'm Rebecca Landa, Director of the Center for Autism and Related Disorders at Kennedy Krieger Institute. You are about to watch a brief tutorial illustrating the early signs of autism spectrum disorders, or ASD. You will see 3 pairs of videos of 1-year-olds. Within each pair, you will first see a child with neurotypical development, followed by a child who shows early signs of ASD. The developmental features indicative of ASD shown within these videos fall into 3 main categories. These include effective communication and sharing enjoyment, making social connections, and the one with which we will begin, seeing social opportunity through play. This 19-month-old child does not show signs of ASD. He has chosen to play with the balls. He quickly integrates the lady into his play. He pretends that the balls are food and offers a bite to the lady.
He pretends a lot of stuff is food, and he always wants you to
offers
eat
it to you. Okay. You're making some yummy food.
He understands that food, spoons, plates, and eating go together. As he creates a pretend play activity, he remains aware of the people nearby. He enjoys incorporating social interaction into his play and offers the lady a bite.
Thank you. That sure is tasty.
He is able to pay attention to the lady, the doll, and the pretend food all at once. He shares his excitement about the toys with the lady, looking at her and smiling. After the lady comments that the food is hot, he links his play and language to her idea.
It's okay now. It's cool. It's nice and cool now. Yeah.
Here, he imitates the lady's action with the pretend lipstick.
Oh, my lips are pretty now. My lipstick on. Oh, it doesn't come off.
This helps him to learn new play skills and at the same time synchronize his actions with the actions of others.
Yeah, she has lipstick on. Oh, just like Mommy wears. You look so pretty. Thank you.
This 19-month-old child shows signs of ASD. He has an intense interest in the toy phone. He does not share his enjoyment of the phone with others. He does not look toward others and smile.
Shows, sensory, all kinds. He really has this addiction to telephones lately, though. It's okay though, because it's helping him to make sounds. So there's probably like 10 telephones laying around my house because he walks around carrying them and sits them down, and then he goes on to the next one.
Although he puts the phone to his ear, he does not show creative play with the phone. When his name is called, he does not respond.
Elliot. Ellie. Ellie. Elliot.
He does not offer the phone to others so that they can have a turn.
He would turn to his hand, and progressively he's not.
His mother tries to distract his attention away from the phone.
Let Mama see the phone. Let Mama see it. Let Mommy see the phone. Are you being helpful now? Are you being
There you are.
She begins to tickle him. Although he seems to enjoy the tickling, he does not look at his mother or make a social connection with her. He does not try to communicate with his mom to keep the social game going. 14-month-old child has a mild motor delay but does not show signs of ASD. As he explores the new toy, he remains aware of the people nearby. He checks in with his mother behind him to ensure that she also sees the toy. Next, he shows that he understands the social communicative meaning of the woman's pointing gesture by immediately looking at the sticker. Then he looks over at another sticker she had pointed out before. He continues the woman's topic of communication as he points to the Tigger sticker. He shows the motivation to maintain social engagement with others and the ability to communicate using coordinated gaze, vocalization, and gesture. This 14-month-old shows signs of ASD. First, he flaps his hands while enjoying the bubbles. He does not share his enjoyment by looking at the man. He does not respond to his name.
Ben. Ben. Ben.
Although he looks at the man's pointed finger, he does not follow the direction of the man's gesture to locate the object of the man's attention. This 14-month-old does not show signs of ASD. While she enjoys looking at and exploring the toy, she stays engaged with the people nearby. She tries to share her enjoyment with her mother as she turns to show the toy to her. Then, she shares her enjoyment with the lady across from her by directing her gaze and smile toward the lady. Also, she recognizes that the lady is a source of help. Her request for help is clear and effective. Coordinating eye contact, gesture, and vocalization for purposeful communication is a sign of healthy social and communication development. This 14-month-old child shows signs of ASD. Notice how his attention is so focused on the toy that he does not interact with the people nearby. He does not share his attention with others. His exploration of the toy is also unusual. He drops the toy onto the table and watches it move. When the toy stops moving, he does not use eye contact, vocalization, or gesture to ask for help. He also tenses his body and mouth in an unusual way. Even though the lady is talking to him, he shows no interest in her. He does not seem to understand that her gesture is an offer to help him. He does not check in with the lady or his mother to see whether they are paying attention to the toy that he is enjoying. ASD is a neurodevelopmental disorder affecting multiple aspects of development, especially social and communication skills. Children with ASD often show unusually intense interests in certain objects or sensory experiences. They may repeat certain behaviors over and over again. The signs of ASD are not transient, but rather persist over time. The earliest signs of ASD are often subtle and become clearer in the second and third year of life. A diagnosis of ASD should be made by one or more experts who gather a thorough developmental history, directly assess the child's developmental abilities, and conduct a medical exam.
Now let's look at the intervention for autism. So, main purpose of autism intervention is to help autistic individuals acquire new skills and or to modify their existing skills to meet their functional needs. So what we have to understand here is that any of these treatments, they don't aim to cure autism. Instead, they help to improve the child's overall ability to play, to interact with others, to function academically, and perform well with their adaptive skills. and not every treatment approach is effective for all the autistic individuals. So a combination of treatment approaches may be used to meet their specific needs. And thus, learning about the many different treatments available can help us to identify which approaches are the best suitable for a child's needs. So, moving on to the different types of therapy. So, here what I would like to highlight is the importance of early intervention. So, early intervention services, they play a crucial role in autism management. So these are the services that are provided during the early years of life, such as 2 to 3 years of age. So it's during this period that a young child's brain is developing, and there is a potential for changes. So hence, treatments have a better chance of being effective in the longer term. And also in some cases, it's been found that early intervention helps a child to lead a near normal life later on. So it focuses on building up skills that are usually learned in the first 2 years of life. This may include physical skills, playing skills, thinking skills, communication skills, as well as social and emotional skills. The next is occupational therapy. So an occupational therapist focuses on daily living skills such as brushing teeth, toilet training, bathing, and other grooming skills. Fine motor skills required for holding things in their hands, such as writing or eating. Gross motor skills, which are required for walking, climbing stairs, riding a bike, and also on sitting, posture, and perceptual skills, such as telling the differences between colors, shapes, and sizes. Awareness of their body and its relation to others. They also work on visual perception skills, which are required for reading and writing, on play skills, self-help skills, problem-solving skills, and also most importantly on their self-regulation skills, attention and focusing skills, etc. Next up is a speech-language therapist. So children with autism, they can either have a delay in their speech or sometimes a complete absence of speech. So a speech therapist will work on to improve the child's intent to communicate and also to help them express their needs verbally or non-verbally. So this may include expressing their wants, their needs, protest, agreements, disagreements, feelings, to comment, ask questions, etc. So a speech therapist may also make use of a device or any other non-verbal form of communication, such as gestures, picture communication, sign language, typing, etc., based on every child's need. So in speech language therapy, the therapist may also focus on to improve the child's oral motor skills, which are required for their feeding and speech. And they may also focus on social interaction. They work on using language and improve the vocabulary during play. So thus making it possible for autistic individuals to interact with others, form relationships, and function in day-to-day life. Next up is play therapy. So basically play is children's language through which they express themselves, and it helps them to learn and connect with others in a way that they relate to. So play therapy is provided by a certified play therapist, and it helps to improve the following skills such as attention span, sensory regulation, fine and gross motor skills, social and emotional skills, flexible thinking skills, language and communication, their ability to play with a variety of toys, their ability to relate to people, etc. So next is the oral placement therapy. So it is considered as one of the most effective and evidence-based therapy to improve oral motor skills required for speech and feeding. So it focuses on giving additional touch and cue movements, touch and movement-based cues to the oral structures, along with the watch and listen mode of learning. So it makes use of a set of tools such as the jaw grading bite blocks, horn kits, stroke kits, etc., to achieve the oral motor skills necessary for speech and feeding. So the professional needs to be certified in OPT to provide the therapy. The next type of therapy is the applied behavioral analysis, or the ABA therapy. So this is based on the science of learning and behavior. It is provided by therapists who are professionally certified. Here, the goal is to increase the behaviors that are helpful and to decrease behaviors that are harmful or that affect learning. So the main strategies that they use here is positive reinforcement. So here the learner is provided with positive reinforcements or rewards for demonstrating useful skills and socially appropriate behaviors, and no reinforcement for behaviors that cause harm or prevent learning. It is found to be effective for people of all ages from early childhood through adulthood. And so basically ABA uses several different techniques, and they work on to improve communication and language, social skills, self-care, play and leisure, motor skills, etc. And so, but here I would like to bring to your attention the controversies about ABA. So though ABA was considered as the gold standard for autism therapy, it has been a topic of debate since past many years. So many autistic adults and communities have come forward against the ABA practice, and their major claims were that ABA takes away the child's right to deny or say no, and that it does not support the child's individuality and force the children to tasks that they are uncomfortable of. It sets up unrealistic and unnecessary goals such as taking away the child's stimming behavior, which is actually needed for the child to stay regulated, and that it does not support the concept of neurodiversity, which we'll explain in the later part, and considers individual differences as problem behaviors to be fixed. So due to the rising concerns over ABA professionals are coming up with ways to address the concerns by not setting up a predetermined amount of therapy hours, such as 4 hours of ABA therapy or 8 hours of ABA therapy, rather deciding the time, looking at every child's individual skills and strengths, abstaining from making unrealistic and unnecessary goals such as eliminating the stimming behavior and forcing the child to maintain eye contact, which can affect the person's ability to regulate themselves and take away a part of their individuality, allowing autistic members to be a part of the goal setting that will enable them to become autistic self-advocates. All right. So next is the special education services. So as mentioned earlier, autistic individuals may follow a different pattern of learning, and they require help from certified special educators to work on their pre-academic and academic skills. So the educators may analyze a child's strengths and adapt teaching methods according to their learning styles. For example, most of the autistic individuals are visual learners. So the teacher may provide verbal instructions along with written or drawn illustrations about the tasks to be done. Complex concepts are taught by breaking them down into simpler concepts and also by making use of models and demonstrations. Now, let's look at another important topic, that is setting expectations. Parents setting the right expectation is very crucial in an autistic child's intervention journey. Often parents expect their children to behave like the neurotypicals. They set their goals that needs the child to fit into the societal norms and expectations. A few of the commonly set goals by parents include that the autistic child or person should be able to live independently, interact well with their group of friends, think and behave normally, But if we look at all these goals, all these require strong social communication skills and executive functioning skills. And autistic individuals' strengths and abilities do not really revolve around these skills. So many of the autistic adults expressed their preference to solitude over socializing. Hence, most of the time, such goals may seem to be unrealistic for them. So how do we set the appropriate expectations? Parents should decide appropriate goals for their children, truly based on their child's strengths, abilities, interests, and desires. That is, if the child has difficulty with executive functioning skills, then instead of expecting the child to live a completely independent life, we can expect to improve the adaptive living skills. We may also have to acknowledge the fact that the child may need someone's support for planning, time management, and other important tasks. Keep in mind the child's interests and passions before choosing the goals. Their passions can become the foundation to acquire other skills and even their career. While it's natural to desire your child to outgrow their autism, the reality is that autism is a lifelong diagnosis. It is a part of them. Many people with autism develop strong skills in many areas, but they will still be autistic. We need to also understand that while neurotypicals enjoy novelty in life and enjoys challenges, individuals with autism may prefer sameness in their routines and may not be comfortable with changes and challenges. So they may be happy in leading a basic life. Such preferences need to be valued while choosing life goals for them. Understanding realistic prognosis. Parents generally attribute high quality treatments and greater frequency of treatment sessions to yield better treatment outcomes. But even though these factors play a major role in the overall prognosis, there are some other factors that affect too. These include IQ of the child. It is identified as a major prognostic factor. If the child's IQ is affected, then the treatment outcome is expected to be delayed. Early intervention. The age at which the intervention is given can impact the long-term outcomes. So the earlier the child gets diagnosed and begins with the therapy sessions, then better the prognosis will be. Severity of impairments. So when we compare a child with mild ASD and that of a higher severity, then we can understand that for a child with mild ASD, the child can have a faster progress when compared to the child who has a slightly higher severity of the impairment. Comorbid conditions. So associated conditions such as ADHD, anxiety, seizure disorder, etc. pose challenge to the overall progress. Now let's look in deeper into the challenges faced by autistic children. So as mentioned earlier, autism is a spectrum of disorders. That means the strengths and challenges experienced by every child varies. The challenges commonly come under three main domains. That includes language deficits, poor social interaction, repetitive or restricted interests and behaviors. Looking into the communication difficulties, so autistic children show communication difficulties as one among the earliest signs. So they can show differences with respect to their pre-linguistic or pre-language and language skills. So the challenges usually begin with the absence of pre-language skills, such as absence of appropriate eye contact during an interaction, lack of alternating back and forth babbling during the infancy stage, decreased use of pre-speech gestures such as waving, lack of expression such as uh-oh. And the challenges that are seen with respect to language development include a delay in their speech and language skills, or a regression of previously acquired vocabulary, absence of verbal expression, echolalia, scripted speech, non-contextual use of language, etc. Let's look deeper into these. What is echolalia? Echolalia is the repetition of utterances from someone else's speech. So that is, the child may repeat the speech in the same intonation in which it was heard. An example is that the child may hear his mother say, "Do you want juice?" And then the child promptly says, "Juice." Remember, here the child will try to repeat back using the same intonation. So when the repetition occurs immediately, it is called as immediate echolalia, and sometimes it can occur after hours, days, weeks later. So that is called as delayed echolalia. Another term is scripted speech. So that is, a child repeats a word or phrase he has heard elsewhere, such as from a television program, movie, cartoons, etc. And scripting is a form of delayed echolalia. The child uses the phrase out of context. For example, when a child is asked, "How are you doing?" he may just say, "Row, row, row your boat," which is a line that he heard from a rhyme. So it is important to note that typically developing children also often go through a period of repeating the last word or phrase they've heard as a part of learning words. But here, one distinction will be the intonation. For example, when the parents ask, "Do you want juice?" a typically developing child will say juice. So here the intonation will be different, like an emphatic declarative intonation, while the child with autism may repeat back exactly the same way as it was told in the same intonation. For typically developing children, the period of word repetition may last several months in the second year of life, but for children with autism, this word repetition may continue. That's another distinction. Let's talk about the social communication difficulties experienced by autistic individuals. So for them, the use of language at a social context can be very challenging, and the difficulties that they may experience include difficulty in understanding the nonverbal cues such as gestures, facial expression, emotions, tone of voice of their communication partner, difficulty to give appropriate responses and taking turns during conversation. They may have difficulty in speaking in an appropriate loudness, so they may speak louder or quieter than what is expected. They may speak in a flattering voice, or they may have difficulty speaking in a flattering voice, or they may speak in a different intonation than what is usual. Talking about topics that may not be relevant in that specific situation. They may talk excessively in large detail on a topic of their specific interest, which is also called as infodumping. They may have difficulty recognizing sarcasm, jokes, idioms, and expressions such as "it's raining cats and dogs." They may take the literal meaning out of it. They may have difficulty to engage in small talks that usually smooths interactions among new people, or in a highly tense situations, such as talking about the weather. That may be very difficult for them. Difficulty understanding and using pronouns correctly. They may show pronoun reversal, wherein they may say "I" for you and "you" for I. Non-speaking autism. It is found that about 1/3 of those who are diagnosed with autism spectrum disorder are non-speaking or non-verbal. They may be minimally verbal. That means they may have speaking vocabulary of less than 30 words or so, or they may not have any speech at all. For some of them, the reason could be the presence of a condition called apraxia of speech, which is a speech planning and programming disorder. And non-speaking does not mean that they lack the ability to understand others. They can have excellent understanding skills and can also communicate effectively through other modes of communication, such as through pictures, writing, etc. Now, let me take you through a completely different but very important topic, which is the language processing in children. So there are two different ways through which children learn language. One is called as the analytic language processing, and the other one is gestalt language processing. So let's look at the differences between these two types of language acquisition. So if a child is analytic language processor, which is ALP, then here the child learn language by saying single words first and then move on to combining 2 to 3 word combinations. For example, the child may say cow after seeing a cow, which is a single word utterance. Whereas if a child is a gestalt language processor, then the child will start to process the entire language and express in whole chunks or gestalts rather than single words. That is, the child may say an entire chunk, such as the cow says moo, just to refer to the word cow. And in case of an ALP, single words carry individual meaning, whereas if the child is GLP or gestalt language processor, then the entire chunk, not the single words, carries the meaning, or they consider the entire phrase as a single word here. Next difference is that in case of an analytic language processor, their language is flexible and they can produce variety of sentences. Example, the child may say go out, or I want to go out, mommy is going out, etc. while going out. In case of a GLP, their language is inflexible and it's the gestalts that carry meaning based on the situations. For example, the child may say, do you want to go out? Which he must have heard every time he was going out to indicate that he wants to go out. So another difference is with respect to grammar. For an ALP, their grammar is a big focus while learning the language. Whereas for GLP, though the scripts contain complex grammar, they may not pick up the grammar properly until the later stage. And in case of an ALP, the intonation or the pitch of your voice as you speak, the intonation of language develops later when they learn to speak in phrases and sentences, whereas in case of a GLP, they pick up and use the intonation first and the meaning later. So they give a lot of importance to the intonation here. Or most of the time it is the intonation that carries the meaning or conveys the meaning here. In case of an ALP, it is actually the most common or typical development of language. And in case of gestalt language processors, this is how hyperlexic, that is a child who can read at levels far beyond those expected for their age. And most of the autistic children develop their language. So that's why we are discussing about the different types of language processing here, because most of the children who are autistic, they are GLP or gestalt language processors. So here is an example that is given. If the child is an analytic language processor, then the child may start from a single word and then learn to combine the different word combinations as the child acquire language. Whereas if the child is a gestalt language processor, then it's all about combining different chunks of language or gestalts. So as I mentioned earlier, most of autistic children are gestalt language processor. They may use their delayed echolalia as a gestalt. We have discussed about delayed echolalia earlier, which is nothing but the utterances that a person is echoing after a gap of time, not immediately after hearing it. So hence we must understand that autistic children produces delayed echolalia not randomly, but it serves a communication function. And this is something that we need to tap on while the child is attending speech language therapy. Moving on to the next topic, that is feeding difficulties. Majority of autistic children experience feeding difficulties, and it could be because of an underlying oral motor sensory problem. So the oral motor aspect refers to how the mouth muscles function, the strength of the muscles, how far they can move, and how coordinated are their movements while manipulating food in the mouth and while speaking. The oral motor difficulties may include reduced movement, strength, and coordination of the movements of the oral structures such as the jaw, tongue, lips, etc. Poor oral motor skills may result into feeding difficulties such as poor sucking, chewing, and swallowing skills, along with poor speaking skills or poor articulation. And the oral sensory aspect of eating refers to how the mouth tissues perceive sensory information such as the taste, temperature, and texture of the food. Children can have problems with either sensory or motor, or sometimes both sensory and motor. Some children show increased response or hypersensitivity to oral stimuli, causing them to gag or show grimace, while others may show decreased response or hyposensitivity, that is, they may not feel food in their mouth or let the food drop out of their mouth without realizing it. Some children with oral sensory problems may also show aversion to certain food due to their previous negative experiences. Moving on to the next topic, that is models of autism. Autism spectrum disorder can be explained using two prevailing models. One is the medical model and the other one is the neurodiversity affirming model. So it is necessary to understand these two models and how they define autism. These models form the foundation for the assessment tools and the treatment strategies that are designed for autism. A thorough understanding of these will help us choose the best practice for autistic individuals. For example, the ABA that we discussed earlier is based on the medical model, and the neurodiversity affirming practices are based on the neurodiversity affirming model. Let's look at the medical model. The medical model explains autism as a medical disorder characterized by a set of deficits or impairments within an individual. It believes in curing or fixing these impairments or differences through medical treatments and rehabilitation. The medical model aspires towards normalization, symptom reduction, and elimination of conditions identified based on deficits said to cause functional impairment in major life activities. The focus is given more on the weakness of a person or what a person can't do than the abilities. So majority of grown-up autistic individuals view their condition as a part of the normal diversity of human nature and do not wish to be labeled as having a disability. So the medical model often forces the autistic people to change themselves and follow what is called the norm, regardless of how they feel, and this leads to othering of autistic people. Othering is a process where some people are categorized as others, which leads to their alienation from the larger society. Such segregation of people as being different may lead to stigmatization and exclusion. Next is the neurodiversity affirming model. So many individuals in the autistic community found the treatment methods following the medical model, such as the ABA, to be counterproductive and harmful in the long run. So the goals of ABA intend to change behavior of autistic persons to reflect the neurotypical norms and standards. So it leads to issues such as masking and autistic othering. Masking means suppressing certain behaviors the autistic individuals find soothing, but that others think are weird, such as stimming or intense interest in different topics, in order to fit into the societal norms. Thus emerged the concept of neurodiversity. So the term neurodiversity refers to the unique neurological variations within the human mind. It simply means that not all brains take the same developmental pathway. While many children follow a neurotypical development, others have development that diverges from this. A neurodiverse person may think, feel, process, and behave outside the typical range in comparison to their peers. The neurodiversity movement embraces neurological differences in people and accepts this as a difference. Further, it advocates this neurological divergence should be accepted in society. Here, the focus is given on embracing the differences and supporting them further. Instead of fixing the impairment, effort is made to fix the environment to be more accommodative. Now, let's look at neurodiversity affirming therapy. In neurodiversity affirming therapy, the therapist accepts and values the neurodivergent person or child. Instead of viewing the neurodivergent child through the lens of delays, deficits, and impairments, the therapist focuses on accepting their differences and supporting their needs. Hence, the therapy services support and optimize their functioning at home, school, and in the community, and it puts less pressure on the child. The ultimate aim is to help the child to become the best versions of themselves. Neurodiversity affirming speech therapy. Here, the speech therapist will choose goals based on the strengths and needs of the child rather than the child's weaknesses. Here, the therapist will take the child's lead, following child's interest, and do not enforce goals to fix the child. The therapist will not engage in ABA and ableist behavioral approaches or goals, will not engage in goals to fix the autistic child or person, will not train the autistic person to adapt to the neurotypical social skills. The therapist accepts and validates the autistic child, advocates to support the needs of neurodiverse people. Here, the clinician conducts respectful and empathetic therapy. They target self-advocacy and child-led activities. They conduct and write neurodiversity conditions affirming goals and activities. Now, let me share some tips for speech and language development. So, the strategies that we use to stimulate language development can vary slightly depending upon whether the child uses analytical or gestalt language processing predominantly. So, regardless of that, here are some of the tips that we can follow. One is encourage play and interaction. Play is a child's primary language, so it is through play that children learn language too. So interactive play allows the child to have fun and communicate. So follow the games of child's interest that can also promote social interactions such as peekaboo, pat a cake, or reciting rhymes, taking turns, etc. Next is imitate your child. So when you imitate your child's positive play behaviors and sounds, the child will start paying more attention towards you. You can also add language and words while imitating the child's play. For example, when the child is rolling a car, we can say, "Room, the car goes room, room." Next is model language. This is a very important strategy that we use to stimulate language. So modeling is an important strategy for language development. The way we model language varies depending on whether the child is an analytical or a gestalt language processor. If the child is an analytic processor, then we have to model one step above the child's current language level. For example, if your child can gesture or reach out to get milk, then you can model the word milk. And if your child says go while playing with the car, then you can model two-word utterance, that is go car. If the child can say car, go, which are two words, then we can model three words utterances, that is cars go or car goes fast. If the child is a gestalt language processor, then our language modeling will be based on what stage the child is in. Next is using simple language. Autistic children usually have language processing difficulties. When we model simple language, it is easy for them to understand and also to imitate the utterances back. For example, when the child is playing with the car, instead of saying, "Look, the car is going very, very fast and it's overtaking the bus," we can model simple language like car goes fast, etc. Incorporate nonverbal cues. Nonverbal language assists development of verbal language. So we can encourage the child to use nonverbal language such as pointing, gestures, etc. by modeling them. Use your body along with your voice while communicating. For example, point using your hand while saying look, nodding your head while saying yes, etc. Follow your child's lead. Now, this is very important while we work with autistic children, because children with autism, they can have their own special interests and routines. Instead of forcing the child to do the tasks you demand, you can follow the child's interests. If he is interested in playing with stacking or aligning colorful blocks, then doing the same activity itself, we can model language such as on top, fall down, yellow block, etc. Now here, remember, modeling of the language is done based on whether the child is an analytic processor or a gestalt language processor. The child is more likely to pay attention to your words when we are talking about their interests. Label things and feelings. So name the things that the child is using or the things that are around them. Talk about the feelings that the child experiences. If the child wants food, let the child know that he is feeling hungry. Give time to respond. When we ask a question to the child and he does not respond, we naturally have a tendency to fill in the language for the child. However, by doing so, we are taking away an opportunity for the child to communicate. It is advised to wait at least for 10 to 15 counts or seconds before we prompt the child to respond. Interpret the child's communication attempt. Autistic children's communication attempt may look different than typically developing children. They may drag you towards the desired object or repeat phrases that may seem irrelevant to that situation to us, but make sense for them. So watch your child carefully and understand the child's attempt to communicate. Try to interpret what the child is trying to convey. You can also model the language expected of that situation. Now, let me share some oral motor tips and exercises with you. Oral motor exercises can help improve the strength, movement, endurance, and coordination of oral structures involved in speech and feeding. Here are some of the exercises that can be carried out with each of the respective oral structures. You can try to incorporate these into the daily routines. Each exercises can be done for 3 sets, 10 trials each, or according to the child's abilities. You can make the child sit in front of a mirror while carrying out these so that he gets a feedback. Every child learns at his or her own pace, hence progress may be noted in a few days in some children, while it may take months in others. If you are already consulting with a speech language therapist, please follow their advice while doing these exercises. These tips should not be considered as a substitute for the therapeutic interventions such as oral placement therapy or prompt therapy. Researchers suggest that practicing these exercises in isolation will not help in developing speech. Isolation means just practicing it as such without incorporating any speech sounds. But these exercises can, however, help improve the child's imitation skills, joint attention, awareness of the mouth, coordination of oral motor movements such as movements of jaw, lips, and the tongue while drinking through straw. Now here are the exercises for the lips, jaw, and tongue. First one is smile and hold for 3 seconds, relax and repeat the same. Like this. Say ooh with exaggerated round lips, then say e, and now combine them. Ooh, e, ooh, e. Say pop, pa, pe, with exaggerated pressure on the lips. Lollipop squeeze. Hold and squeeze lollipop with your lips for 6 seconds. Make a kiss and hold for 3 to 6 counts. This would encourage lip rounding or the fishy face. Smack lips together. Make humming sounds. drink through a wide or a twisty straw, blow bubbles and say pop while popping the bubbles, blow horns, party blower and whistles, holding an ice cream stick between the lips for 10 to 20 counts, chewing on a chewy tube on the molars or the back teeth, chewing crunchy food such as apple, carrot, etc., saying ah, o, oo, e, etc., lick lollipops up and down, protruding the tongue outside the mouth, put a Cheerio or a Honey Loop cereal on the lower lips and try to take it using the upper teeth like this. Make tongue clicks and popping sounds. Make sounds with tongue tip such as ta 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 ta, na 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 na, da 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 da. Also try a combination of these sounds such as ta, da, na. Say la la la. Now here are a list of toys that you can buy while working with autistic children. So first and foremost are the sensory toys. Most of the children on the spectrum enjoy sensory toys. These toys help them to focus better, calm down and relax. Through the use of play, a child with autism learns to understand their senses and how to manage them. Sensory play also helped develop fine motor skills, problem-solving skills, and social emotional skills. So the first one are the sensory mats. A series of sensory mats make a great sensory toy. These are mats with different textures, such as soft, rough, bumpy. Children can then use their hands or feet to feel and play with the different types of textures. You can even close the child's eyes and make them walk through the mats. And don't forget to provide appropriate language while playing with these mats. Next are the sand, Play-Doh, and slime. These are great sensory toys to work on tactile sensitivity and fine motor skills. The child can play with them alone or incorporate other toys such as hiding a small car inside the Play-Doh or the sand. Fidget toys. These are great toys to help the child calm down while feeling anxious. These toys help children focus by keeping their hands occupied. Many children with autism who are visual seekers love watching the fidget spinners rotate. Pop-it toys are great to keep the child relaxed. Next is motion lamps and liquid motion bubbler. These are interesting visual toys that help to keep the child calm and relaxed. Cause and effect toys. So these toys can help improve interactions with others. These toys teach that our actions can cause a change in the environment. They also work great to work on turn-taking and can create opportunities for positive interactions for the children and their family. So one example is a pop-up toy. Next are the stacking, building, and construction toys. These toys are great for engaging kids. Many autistic children love arranging blocks or cups in a specific way. They can learn problem solving, following directions, and also improve fine motor skills. The construction toys also cater creativity and imagination skills. Bubbles. This is an eye-catchy toy for children. Children find it fascinating watching the bubbles move or pop. It also helps to improve oral motor skills. So far, we have learned about different aspects of autism. However, to gain more insights on how it is to live with autism, what are the various challenges experienced by autistic people, it is better to read books written by autistic individuals and their caretakers. So, listed here are 10 books that are reviewed at 1SpecialPlace. So book number 1 is titled The Reason I Jump by Naoki Higashida. The author is a smart, self-aware autistic boy who wrote this book for his mother. In this book, he talks about his feelings, thoughts in his mind, and much more. This book opens up about an autistic child's experience. This book is an eye-opener for parents. And the next book is titled In a Different Key, The Story of Autism by John Donovan and Karen Zucker. This book talks about autism, its origin and history, and the way it was viewed. It includes chapters on different treatment techniques used, modern treatments, and much more. It is an informative book. So the next book is titled Thinking in Pictures, My Life with Autism by Temple Grandin. The author is autistic herself. This book talks about how an autistic person perceives the world. Further, it talks about how people visually perceive the world. It was made into a movie and the movie won several awards too. The next book is titled 7 Keys to Unlock Autism by Elaine Hall and Diane Isaacs. This book documents Elaine Hall's journey with her son. She talks about how she approached autism and about her perspective as a parent and professional. The book lists in detail about the 7 key approach. It also throws some light on understanding autistic people. The next one is Understanding Autism for Dummies by Stephen Shore. This book is for both parents and professionals. It covers a broad range of perspectives. It talks about the medical and physical issues seen in autistic people. It also gives details on autism, its treatment, and on supporting autistic people. It is also a survey book with a personal touch by the author. The next book is titled We Walk, Life with Severe Autism by Amy S.F. Lutz. In this book, the author talks about her life with her 21-year-old autistic son. She also talks about the diagnosis, their perspective, and therapies. This is a good read for caregivers of autistic children. The next book is titled All My Stripes by Shayna Rudolph. This is a sweet story of a zebra who feels different from the rest of his classmates. The zebra in the book has an autism stripe, hence feels different. Further, the author wrote this book to help explain to her daughter what is autism. Next book is titled Positive Parenting for Autism by Victoria Boone. This book is on using applied behavioral analysis for autistic children. Further, the author talks about positive parenting using principles of ABA. So if you use ABA for your child, you may enjoy this book. The next book is called Beyond the Blue by Gopika Kapoor. This book talks about a mother's journey with autism. The author talks about her life with her autistic son and describes in detail love, life, and autism. It is a must-read for caregivers of autistic parents. The next book is Born on a Blue Day by Daniel. The author writes a fantastic autobiography of his life as an autistic servant. It is a best-selling book with wonderful reviews. The author talks about what goes on in his mind. The book narrates what a severe autistic person feels and perceives. It is an inspiring read for autistic people and caregivers. So now it's time to discuss some home ideas for language development. As we all know, home is the best place where a child can learn the best. And it is where the child spends most of his time with the most comfortable people. So listed here are the activities you can carry out easily at home to encourage language development. So for young children, an easy game would be peekaboo. So playing this game can help improve attention, imitation, turn-taking skills, and grow their understanding of language. So peekaboo, this is a routine game. That is, it is played the same way every time. So it allows the child to take turns as he can expect what is going to happen next. To play this game, You need to be face to face with the child so that he can watch your face or your mouth. You can even use your cloth or your hands to hide your face and then say, Pika. Now you take off the cloth or your hands by saying, boo. So in the initial stage, you can just say boo instead of peekaboo, as it will be easy for the child to imitate the word boo. The next one is sing-along nursery rhymes. So we all know that many children with autism enjoys listening to music and reciting it. It helps them to recognize words and associate words and sounds to objects. Majority of the nursery rhymes lines are repetitive, thus making it easy for the child to remember them and learn the words. So rhymes are the best way to teach children some of the early speech sounds. For example, Baba as in Baba Black Sheep, E-I-E-I-O from Old MacDonald's, Moo, etc. These are some of the simple sounds that the child can learn from these rhymes. The song Old MacDonald can help associate sounds to animals and learn names of different farm animals. Rhymes also encourages simple turn-taking skills. You can take turns in singing the lines, such as the wheels on the bus goes, and then you can wait and let the child finish it for you. Through rhymes, we can also teach early literacy and numeracy skills. These include 1, 2, 3, buckle my shoes, 5 little monkeys, jumping on the bed, 5 little ducks, the alphabet rhyme, etc. You can emphasize and exaggerate some easy words which the child can imitate back. Next one is sensory play, and this is very important for children's learning. Majority of autistic children have sensory processing difficulties. Sensory regulation forms the foundation for learning and cognitive development. Sensory play or messy play helps the child to engage his senses, that is vision, hearing, touching, smelling, etc. And this can enhance their learning. It also helps to improve attention and concentration, problem-solving skills, fine motor skills, social interaction, and language development. Incorporating sensory play as a part of child's daily routines is a great idea, as it provides plenty of opportunities for language development. While engaging in the play, we can encourage the child to describe how it feels, the color, the smell, sound, and also work on following directions. The sensory toys can be selected based on child's sensory preferences. Sensory or messy play may include playing with slime, paint, shaving foam, sand tray, water play, etc. So here is an example. Take a tray filled with sand. We can have the child transfer the sand into a bucket using a shovel. We can talk about actions. Put in the bucket, put more sand, etc. We can also expand the play by using small animal models. Hide them in the sand. Let the child dig in and find the animals one by one. We can comment or ask, where's the dog? Oh, here it is. The dog is hiding in the sand, etc. We can model names of the animals, teach prepositions such as in, under, on. We can teach action verbs, dig, hide, adjectives such as soft, rough, small. We can also work on asking questions. Next one is communication temptations game. So this is a great idea to build language and can be easily carried out at home. Here we use a sabotaging technique. We create situations that can tempt the child and that we obstruct any ways the child can access it freely. So one idea is to keep the child's favorite snack inside a transparent container out of his or her reach so that the child gets an opportunity to ask. This works only if the child has joint attention skills, wherein his or her attention is not only on the item but also on you and tries to get your attention. Expect the highest form of communication that your child is already able to do. That is, if the child does not and also if the child does not respond, then you may have to start with prompting. So if the child can tell the name of the item, but he's only looking at you, then you can say, Oh, I see you need something. Can you tell me what you want? Or do you want this? The next one is labeling. Labeling things are a great way to improve vocabulary. The child must learn to associate the verbal label with the real object. We can work on labeling by following your child's lead and naming or talking about the object they are looking at. For example, talk about its use, its color, etc. If the child has a cup, then you can label the name, cup, its function, we drink from it, color, oh, it's a red cup. So it is important to keep your language short and simple so your child is more likely to understand and imitate. Here is an easy game that can be done at home to work on labeling. The items can be chosen based on the child's interest. So the game is called the Feely bag. So here we fill a bag with approximately 5 everyday objects or toys. Example, brush, ball, banana, teddy bear, spoon, book, etc. Pull out each of the objects one by one, labeling them as they are taken out of the bag. Allow your child to explore the objects and model what you do with each one for your child. For example, brush, we brush our hair with the brush. And talk about the object and repeat and model the name of the object for your child as many times as possible. This will help him or her to relate the word he or she is hearing with the object. After you have explored all the objects with your child, take 2 of them out of the bag and label them. Example, banana and ball. Then ask your child which one they would like. Once you have explored all the items in the bag, replace them with 5 new objects and repeat the same activity. Next is matching and sorting games. Matching and sorting games are great ways to teach children about the features of the objects and also to learn categorization. As the child puts words in groups, they learn to associate other words for that specific group. It can also help improve the attention, fine motor skills, and problem-solving skills. These matching and sorting games can be done using real objects or pictures. They can sort items based on their colors, shape, use, categories, etc. An example of this will be sorting real fruits and vegetables into 2 different baskets. And when we begin sorting activity, it is always better to sort items with drastic differences. For example, sorting animals in one basket and maybe clothes in another basket. Next is using visuals or picture boards. So autistic children usually find it difficult to follow instructions or tasks in the correct order. Since many of them are visual learners, using visual schedule or a picture board will make it easy for them to understand the tasks they have to do. While making the picture board, we can use a child's own pictures of doing these tasks or any other child's pictures. For example, a picture of the child eating snacks can be used to represent snack time. Similarly, the child's picture of playing can be used to represent playtime. If the child can comprehend, then we can also use drawn images as well. The pictures can be arranged in the actual order of events for the child to follow them one by one. Next is reading books. Reading books with your child can provide experiences and vocabulary that he or she may not be exposed to on a daily basis. When a child understands vocabulary and situations, he or she has the foundation to use these words in verbal language. While selecting the books, we must understand that all children have their own unique learning styles. Some are strong visual learners but may have difficulty to focus on text-heavy books. In such case, books with more illustrations, more pictures, and less text can be great to make it engaging and overall experience more fun for them. While some children are auditory learners, so they may prefer to have conversations or things explained to them out loud. In this case, audiobooks can be used, or you can read out stories to them. Always read with your child face to face with the book next to your face, not in front of your mouth. This will allow the child to see how you move your mouth when you say words. It will help them to see your facial expressions and engage in eye contact. Read with intonation, feeling, show emotions, and pause to allow your child to vocalize back to you. Selecting books with repetitive phrases may improve interaction during story time. For example, book Dear Zoo by Rod Campbell, then The Very Busy Spider by Eric Carle, and The Gingerbread Boy by Richard Igelski. So all these books allow that. So allow your child to complete the repetitive line, or if he or she is ready, the whole line. Hopefully these words can be carried over later into their daily routines. Rhyming books help children with word prediction, which is crucial for reading development. Once familiar with a rhyming book, have your child try to fill in the rhyming word. Example, in the storybook Brown Bear, brown bear, what do you see? Once they get used to this rhyming line, they'll be able to predict the line when it comes next. Books also allow us to teach other concepts such as prepositions, action verbs, pronouns, adjectives, WH questions, etc. You can also try asking open-ended questions. Example, what's happening over here? Model the language if it is challenging for the child. After the child finishes reading, use the crowd strategy to develop more language. That is, C for completion. Allowing the child to complete a recurring sentence. Example, brown bear, what do you? So you pause and let the child finish it. R is for recall. Recall what happened happened to the character in the story. O for open-ended. Ask what is happening by showing a picture. Rather than asking a direct question like a yes or no question, you can ask an open-ended question. Let them explain it to you. Next, W is for WH questions. Ask different WH questions such as what, who, where, why, etc. from the story. D is for distance. Ask a question related to this from child's experience from the past. For example, how was it when the child went to the zoo and saw a bear? So that's all the home language development ideas. So here are the services that we provide at 1SpecialPlace for autism. 1SpecialPlace believes in neurodiversity affirming practices. We believe in therapy that improves a person's participation in everyday life. We believe that every child is unique and their strengths should be valued. Our therapists are trained to be neurodiversity affirming. They set therapeutic plans that support a child's needs. Our approach to intervention is strength-based and respectful of the child's needs. So, the services that we provided at 1SpecialPlace are speech-language therapy, occupational therapy, special education, mental health counseling, diet consultation, early intervention program, parent coaching, workshops and trainings, group therapy, co-therapy sessions, AAC-based therapy, neurodiversity affirming therapy. Need any help? Please don't hesitate to contact us. We would be happy to assist you. Thank you.